Cervical cancer is one of the leading health threats to women worldwide. While factors like HPV infection, poor lifestyle choices, and lack of medical screening play a role, few realize that certain selfish and harmful habits of husbands can also put their wives at higher risk. Below are 3 habits that men should stop immediately, not only to protect themselves, but also to safeguard their partners and families. 1. Smoking around their wives. Many men are addicted to cigarettes, often smoking a pack or more per day. Whether it's stress relief, habit, or social influence, this behavior harms more than just the smoker. Secondhand smoke is almost as dangerous as active smoking. Research shows it can damage a woman's reproductive system and increase the risk of cervical cancer, breast cancer, and even complications during pregnancy such as premature birth or miscarriage. Refusing protection during intimacy. Condoms are among the most effective ways to reduce the risk of sexually transmitted infections, including those linked to cervical canc. When used correctly, condoms are up to 98% effective in preventing transmission. Still, many men refuse to use them, citing discomfort or reduced pleasure. This decision exposes their partners to HPV and other infections that can directly damage cervical cells. Some couples rely on hormonal contraceptives instead. While these are effective at preventing pregnancy, long-term use has been linked to a higher risk of breast canc. Large study from the University of Copenhagen found that women who used hormonal contraception for more than 10 years had up to a 38% increased risk of breast canc compared to non-users. The healthiest way is to combine safe contraceptive practices with STI prevention, not one at the expense of the other. Pressuring intimacy during menstruation. Some men demand S&H while activity during menstruation, not realizing the risks involved. At this stage of a woman's cycle, the cervix is more vulnerable because the uterine lining is shedding and slightly open, creating an easier pathway for bacteria to enter. Medical experts warn that intercourse during menstruation can increase the risk of pelvic infections, trigger gynecological inflammation, over time raise the risk of cervical and uterine complications. If infections are left untreated, women should feel empowered to refuse intimacy during this period and prioritize their long-term health over temporary satisfaction. Overall, cervical canc prevention is not just a woman's responsibility. A supportive husband or spouse plays a crucial role by avoiding harmful habits like smoking, refusing protection, or demanding intimacy during unsafe times. Men can help safeguard the health and well-being of the women they love. True care in a relationship means protecting each other, not just emotionally, but also physically. Please like, share, and subscribe to our channel for more valuable information. Thank you.